Hello, my name is Helen Stevenson. I'm founder and CEO of Reformulary Group, a healthcare company based in Toronto. Welcome to the first in a series of videos on the COVID-19 vaccine journey. This has been arguably the biggest story of the past decade, and it may even be the story of the century when all is said and done. To set the stage, I want to take you back in time just over a year ago. Reformulary Group has a committee of medical experts. One of the members is a leading infectious disease doctor. These two comments, a few days apart, really show how quickly early understanding of the pandemic changed. It's a big thing, but maybe just in China. Doesn't look as bad as SARS. Came out of China, it came out of left field. China's going to extraordinary lengths. They've locked down 36 million people. We will have cases in Canada. And you can see here the timeline of events from discovery to unprecedented shutdowns is very quick. Pneumonia cluster was first reported by Wuhan health authorities on December 31st, 2019. The first recorded case outside of China was in Thailand on January 13th, 2020. Here in Canada, that timeline is even more truncated. There were barely 8 weeks between confirming patient 0 and large-scale closures. Patient 0 was identified on January 25, 2020. The first death in Canada was likely in Ontario on March 11, 2020. Here in Ontario and in much of the country, we went into complete lockdown on March 23, 2020. Here's how the very early days unfolded in international media. January 7th, 2020, CNN headline is, quote, "A mysterious virus is making China and the rest of Asia nervous. It's not SARS, so what is it?" And the New York Times headline from May 24th, 2020, quote, "U.S. deaths near 100,000, an incalculable loss." On February 22nd, 2020, the U.S. hit the unenviable milestone of 500,000 deaths. Andre Picard is one of Canada's strongest health commentators, and you can see his early predictions for the trajectory of the pandemic. Quote, "There is a new coronavirus on the loose, but we don't have to repeat the mistakes of SARS." Looking back, some of the early mistaken beliefs are quite stark in hindsight. One of the highlighted movies at the virtual Toronto International Film Festival this year was a documentary called 76 Days, which captures life inside Wuhan, China, ground zero, for the outbreak of COVID-19. It's a most extraordinary documentary. Today, that knowledge has evolved considerably. We know more about the mechanism of transmission and window of infectiousness. Time from exposure to symptom onset is 2 to 14 days. People are thought to be most infectious from 48 hours before symptom onset to 5 days after. Typically, it takes 14 years to develop a vaccine. For example, measles was first isolated in 1954, the first vaccine was released in 1963, and an improved one in 1968. In 2020, this work happened in weeks. China shared the COVID-19 sequence January 11, 2020. Moderna's first clinical batch of mRNA 1273 was completed February 7th, shipped to the National Institute of Health on February 24th, and first doses were given in phase 1 trials on March 16th, 2020. That is 63 days between sequence selection and first human dosing. Prior to COVID-19, the fastest vaccine ever developed was for the mumps, which took 4 years. So that sets the stage for how suddenly this virus went from being something that came out of left field, the subject of newspaper headlines about events very far from Canada, to dominating our everyday life. Part 2 of this video series talks about how efforts to develop a vaccine to defeat it matched the urgency of the situation.